So how much will Obamacare play into voters' minds? In November, our panel is back to react. Fred, I really don't know anybody who hasn't been affected, whose plan hasn't been dropped, whose deductibles haven't gone up. Now the other prices are going up as well. Is it going to fall on the Democratic shoulders, people's unhappiness with health care?
Well, it certainly should. You'll remember no Republicans voted for Obamacare back when it passed in, 2010. And look, it's a model that just doesn't work, the Obamacare model. People are required to buy much more insurance, many of them, young people in particular, insurance coverage than they want. So they do one of two things. They either don't buy any insurance at all, then they're asked to pay a penalty, which isn't even enforced now under Obama, or they just go in and out of the health care system whenever they want to. You come up, young people, or they don't go to the doctor much, but if you're in an auto accident, gee, right, you're going to be in the hospital, you need some health care, so you check into Obamacare when you're healed and all right. You check out.
Well, Marjorie,
financially, it doesn't work.
Politically speaking, Donald Trump doesn't have to do a lot to point out some of the cost increases. I mean, health care spending as a percent of GDP has gone up from 13.3% in 2000 to 18.2% in June 2016. And then the rising deductibles. I mean, premiums are beginning to go up as well, but the rising deductibles have grown 67% between the time Obamacare started and now.
Yeah, and the surprise has been that most businesses that we thought would drop their employees' health care have actually kept them. And what we're seeing is that businesses are finding innovative solutions like Acton Care Group, which provides better care for patients and saves businesses a ton of money. So really, this is where the business community has taken over and is really coming to the rescue, frankly, of a lot of American public and keeping health care in a way that we didn't think they would.
But
so
Marjorie, you have to admit, things have changed. I mean, I don't know anybody who's not paying higher deductibles. Your plans have changed, even though President Obama promised they wouldn't be.
Yeah, and unfortunately, the crystal ball on health care didn't work. And again, that's where you're seeing business starting to change the way. Well, it was a crystal ball that, frankly, Fred, a lot of people didn't believe in when these promises were made. Well, but you also have to keep in mind it was a Republican bill to start with. The idea was let the
economy thrive.
But
no Republican voted for Obamacare, Fred, right?
Well, but you know the environment of Congress
Fred,
at that time.
There was no Republican bill. There was one group. The Heritage Foundation at one point was for an individual mandate, but most conservatives weren't. Most Republicans weren't. You know, look, we're going to wind up with one of two things. We're going to wind up with what Hillary calls the public option, which would mean a government, a single-payer system. Full-blown
socialized medicine.
Or we're going to have a more conservative free market system that makes a special adjustment for people who can't afford health insurance. They're going to have to be subsidized in some way. And that's what is in that part, subsidizing the poor, is in Obamacare, but the rest is health insurance that people don't want.
Fred and Marjorie, thank you very much. We'll see you soon. Appreciate it.